Hey everybody, today I want to talk about why in adjusting to neutral we use a translational adjustment always. So we always use a high velocity, low amplitude translation, and there isn't any rotational component in that. We have rotation in the setup, but the drive itself is always a straight vector of motion, a straight line motion. And I want to explain why that is. So sometimes we see something in the cervical spine, and it very clearly is a rotational problem. We can feel a problem with rotation. The joint will move in one direction, but then it won't move in the other direction. So clearly that's a rotational problem, and the kind of quick thinking response is, if it doesn't turn this way, then I'm going to turn it that way. So we'll end up taking the joint into an end range motion. So we take it all the way to the end range, and then we drive it further in rotation, thinking that that rotation at the end range here is going to be sufficient for that particular joint to be able to balance its muscles out so that it can maintain a normal balance of intrinsic muscles to have a normal motion. So what's happening in rotation is, again, we have to have a normal balance of the muscles around the joint for it to rotate. There isn't sort of a pin in the cervical spine about which everything moves. It doesn't sort of move about a physical axis. That axis of motion is basically determined by the function of the muscles around the joint. So as some muscles contract and other muscles, I shouldn't say relax, but as some muscles concentrically contract and other muscles eccentrically contract, we can control the motion of our spinal bones, okay, and the spinal joints. So it's always under control, and this is the intrinsic muscles that are doing this. They're reflexively contracting and shortening and contracting and lengthening to allow for rotation of the cervical spine. If there's a problem with one of those muscles, so say for instance one of the muscles that should be that's stabilizing the cervical spine is too tight and it's less capable of being able to relax, what we're going to find is that the rotation of the cervical spine at that joint, at that particular joint, will shift the axis towards the tension. I think that's pretty obvious to make sense. If things are balanced, it will move like this and the axis stays in the center. If there's tension on one side, what happens is that side doesn't move and the axis of rotation shifts towards where that tension is, okay? So it kind of makes sense initially to take that joint and to kind of twist it the other way to try to resolve it. But that doesn't work for several reasons. I won't go into all the reasons right now, but one is that, and if we take it to the end range, we're going to be affecting a lot of muscles. And it's also very, very difficult to try to reintegrate that axis of rotation by taking it to the end range. We can't be specific, we can't be precise. It's very, very, very difficult. We can do things like that with slower motions, but with a high velocity stretch, it's very, very difficult. However, high velocity stretch is a super powerful way to change the tension of a muscle. In fact, that's the reason why we have these subluxations. If we see that one muscle is tight, it's probably because the antagonist of that muscle, or the opposite of that muscle, was weakened and it was switched off. Its tone and its reactivity were decreased because of some trauma. So we know that if we have a trauma, we can create a very, very fast stretch on that joint and a very fast stretch in the muscle that's trying to resist it. If that force is so great that your muscle can't resist it, what's going to end up happening is that joint will move further than it should, okay? Or you'll create a very, very fast stretch that could potentially damage the joint. So your body knows that there's a sort of speed limit to how much resistance that muscle can give. So if you have a trauma or a force that's greater than our ability to resist it, our body initiates a different reflex that we call resetting the gain of the muscle. So if you didn't follow that last sort of minute, what it means is that when you have a trauma, it's going to have an effect on a muscle. It's going to make that muscle switch off. So when it switches off, that muscle is going to have a decreased tone and a lesser state of reactivity. In other words, it can't contract as effectively. And as the brain tells all those muscles together to contract, if that one particular muscle that was traumatized gets the same signal and it has a lesser reactivity, it can't contract as effectively. So again, what that means is once you have a traumatized muscle, it's weak. It can't contract. And if it's weak, it can't turn off its antagonist. So we see this antagonist tension building up. So we have this antagonist tension building up. What's happened is that's happened as a result of this imbalance that's been instigated by the trauma. So the trauma is a vector of motion. It's much, much easier to understand the effects of a trauma if we see the vector component of a trauma. Traumas are hits. They're pushes in a particular direction. Okay, they're not necessarily being spun quickly. It's a force. It's a straight line force. So what's happening is that trauma is weakening your ability to maintain that center, and then you end up with a muscular imbalance that drives you off the center. So if we can take the joint into the position where it is off center, so in other words, we can deviate the joint to the side or translate the joint to the side and rotate the joint and try to find exactly where that trauma is pulling the joint. So in an adjusting to neutral adjustment, we take the joint into its essentially traumatized position, or the position where the trauma has left those muscles. So if it's left the muscles like this, we let the joint go into that position. And then we try to hunt around and feel where there's resistance of that joint coming back to a neutral position. So as we apply a resistance, and if we hunt around, we'll be able to line our drive up exactly with the vector of the muscles that are keeping it from being back at neutral. So that's kind of the art and the precision of adjusting to neutral, is we take it first into the traumatized position, and we're driving it from the traumatized position back towards the neutral position and resolving that that translational imbalance that's been instigated by the trauma. So when we can drive it back this way, we can use our very fast stretch as a tool to reset the gain and make those tight muscles relax, just as the trauma did, but this is in a very controlled way. We're adjusting and creating a very high velocity, low amplitude stretch on the muscles that are resisting the joint coming back to neutral. So once we do this and we have a greater balance and integrity of those intrinsic muscles, we'll see automatically that the axis of rotation will return because we have a balance of the muscles around the joint. So if we have a balance of the muscles around the joint, then we can reinitiate the axis of rotation because there's nothing keeping it from doing that. And we'll see that that translational thrust can resolve this, and we see an immediate return of rotation in the cervical spine. So yes, we do treat rotation in adjusting to neutral, but we treat it by translation, and we treat it by translation, adjusting the joint from its traumatized position back towards the neutral position. So I hope it makes sense. It's very, very high level stuff. It's probably a bit complicated, and I know I talk very fast, but I hope it's of interest, and I hope it answers some questions about why adjusting to neutral is the way that it is and why we do what we do. We do fix translational problems, and obviously, as I just explained, we fix rotational problems as well. It's all in one. So, but because this is much closer to the effect, the vector of the trauma, because we're actually essentially finding that vector that the trauma took the joint and where it left it out of balance, and we're driving it back towards a neutral position, we can very, very precisely affect only those muscles that are prohibiting it from being back at neutral and from being balanced and having a good rotation. So this is very, very important because when we take the joint from that position, the traumatized position, and drive it back towards neutral, it's a very, very small motion. It's very specific because we're only working on one joint. We're not taking the whole neck. We're just taking one joint. And because we're so specific, and we're going from that position back to neutral, there's very little extrinsic muscles that are involved in preventing that. So we're not actually stretching a whole lot of extrinsics while we're doing the adjustment. We're really, really focused on just those intrinsics and just at that joint and just at that precise vector that is creating the resistance of the joint to return to its neutral and stable position. So I hope that's of interest to you, and if you have any questions, drop them in the comments, and I'll be glad to address those. Thanks for watching.